As expected, the CDC unveiled its updated COVID-19 guidance. If you've been exposed to the virus, you no longer need to quarantine regardless of your vaccination status. You also don't need to stay at least 6 feet away from others. Now, for schools, this new guidance ends the so-called test to stay recommendation, where students who have been exposed test negative regularly in order to remain in class. The CDC says high vaccination rates and the sheer number of people who've already gotten COVID are really the reason for this change. Let's bring in our medical expert, Dr. David Winter from Baylor Scott & White Health. Dr. Winter, it is good to see you. Okay, so let's talk about this new guidance. And I do want to be clear, they're talking here about exposure, not testing positive for COVID.
That's true. They actually point out the fact that they're relaxing some of the recommendations because of, as you mentioned, higher immunity in this country. A lot of folks have had vaccines, a lot of folks have had COVID before, and that helps. Also, they point out we got better treatments right now. So if you do get sick, we have things that can help keep you out of the hospital. So I think it's a good idea. Now, they also emphasize the fact that these relaxed standards occur if you're not in a high-risk area and if you are healthy. If you have underlying medical conditions or some immunological problems, then no, that doesn't apply to you right now. So it's nice to see this, but it'll still have individual judgments for all of us as we get back to, quote, I guess, a new normal.
Yeah, and I think that's a really important distinction to make, Dr. Winter. So the CDC emphasized good treatment options. What exactly are they referring to? Because we've heard about a lot of different options.
And there are a lot out there. There's 2 different pills that are out right now that work pretty darn well if you start them early. You've heard a lot about Paxlovid. There's another monoclonal antibody pill that's out. There's also some antiviral infusions that work well. Now, you have to go to an infusion center or urgent care center to get those, but those work also. So we have some other options right now. Unfortunately, this particular variant, it's highly contagious. We keep talking about that, but we're not seeing the deaths we had early on. So if you're healthy, you can get out a little bit more now. It seems there are good treatment options.
Yes, this darn immune evasive thing we got lingering around. Okay, yesterday it was mentioned that COVID is here to stay. I mean, I think we all sort of knew that. It's not just going to disappear once it's here. That's how it works, right?
Yeah, I think that's right. I compare this to influenza. We got used to that a long time ago. The influenza virus mutates every year. We have new vaccines every year, and that works pretty well. I think it'll be the same also with COVID.
I want to switch gears, Dr. Winter, and talk about monkeypox because we're still hearing a lot about cases rising. Is that the case here in Texas and across the country? What are we seeing?
Yes, indeed, Sonia. We talked last week there were about 6,000 cases of monkeypox in this country. It's up to almost 10,000 this week. Last week we said that 25% of all the cases of monkeypox in the world were here in this country. It's up to 30%. So monkeypox cases are increasing, and they're increasing faster in America than anywhere else in the world right now.
So I'm not sure if you've treated anyone with monkeypox, but with these vaccines in short supply, it was announced that the vaccine administration is going to change and that those exposed will only get a partial dose, like a 1/5 of the dose. So is that going to work? And how are you advising people who are nervous and worried about this, especially in communities where there's high transmission?
Yeah, it's a big problem. We don't have enough vaccines right now. We're told that in a couple months we should have plenty, but in the meantime we need more vaccines. And so what they're doing is they're giving 1/5 of the dose in a different technique where they inject it right under the skin as opposed to in the muscle. And with other vaccines, that does seem to work. You have some kind of higher immune response under the skin rather than the muscle, so it just might work, and it may be our only option right now because there are just not enough vaccines out there.
Dr. Winter, as people are struggling with monkeypox, I mean, this is, I've heard, incredibly painful. What can you offer for people who are in isolation, they're struggling with this pain, and it's like days and weeks of the same for them?
Yeah, you're right. It can last up to 2 to 3 weeks, and it can be very, very painful. Fortunately, let me emphasize, the death rate is extremely low. Prior pandemics, it could be 5 or 10%. We're not seeing that now. This is like less than 1%. But in the meantime, it can be very uncomfortable. So some people just need plain pain medications, anti-inflammatory medications, Advil, Aleve, Tylenol. Those seem to work well. Soothing lotions on the skin lesions, the blisters that come out, that can help some. If you get it, you want to talk to your doctor and first see if you can get a vaccine, or rather the antiviral medication, and then see if you can have some way you can treat these locally, because they can be very, very painful.
Okay. Dr. Winter, thanks for your time today. Appreciate it.